Well, we are going on to our third procedure with Dr. Rizik and his wonderful team over at HonorHealth. And let's go ahead and bring him in now from his office, actually. Usually you're here in studio with me, doctor, but you've been so busy over there that we have to come to you from a Zoom inside your office. How's everything over there right now?
You know, Brad, it's busy. We're in a mini surge, a mini COVID-19 surge. And I believe there's two things going on this summer. The hospital is very busy for two reasons. One is we're seeing a few COVID-19 patients, and they're pretty much all those who have not been vaccinated. So if I can advocate to your audience, please get the vaccine. We believe it's safe and it really does cut down on the disease. So one of the things is that we're seeing a fair number of COVID patients coming into the hospital. But the other thing is, Brad, I think there's a catch-up phenomenon where patients didn't seek health care for a year, and they're starting to come into the hospital now, and they're a little sicker. Length of stay may be a little bit longer because they are sicker. So I think this summer we're seeing a lot of the catch-up phenomenon of patients who didn't get care during the COVID crisis.
And which I'll say I'm one of those doctors. I have to just tell you, you know what? We were just talking before we came on that I had a breathing problem that I let go way too long, and I could have been on the operating table with you taking care of me if I didn't go get it looked at.
Well, I'm glad you weren't, but if I did have to take care of you, you notice I wore my Michigan, University of Michigan cap. I would take care of you with my Michigan cap, and I know that would be a source of inspiration to a Notre Damer like yourself.
Oh my gosh, that's what I love about you, and that's what I love about the procedure is that you make it so comfortable to learn about heart disease. And let's touch a little bit on heart disease because, again, you said with COVID, people putting things off. It's not the smartest thing, and that's where we're seeing more people having heart disease.
Absolutely true. And they are coming in sicker with more advanced disease over the course of the last several months because they did put off their health care. So what do you want to know about what we're going to do next?
Okay. All right. We've done two already. And let's recap really quick what those two were. So the first one was a mitral valve replacement, correct? Did I say it right?
Mitral valve, it was a mitral valve procedure, exactly. And what we did is we repaired the mitral valve. We didn't remove it, put a new valve in place. We repaired it with the MitraClip. The next thing that we did, the next procedure was a coronary procedure. And what we essentially did was to treat a patient with 3 blocked arteries. The audience saw us stent or open one of those blocked arteries live, but we took a patient with multiple arteries blocked and we stented them. And if you remember, that patient went home the same day. It was a really remarkable achievement in terms of what we're doing now in the treatment of coronary disease.
Yeah. So, all right, and then the second one.
No, that was the second. The second one was coronary, and the first one was a valve repair.
Got it. Okay. See, that's why you're here with me, so I make sure what I'm doing right. I want to mention that all that was done without having to open up the chest, which again has been done way in the past. But this new procedure was very, intense, but I say kind of easy for you guys now the way that you did it.
Well, that's our goal. Our goal is to achieve treating a patient with lesser invasive technologies, what we call catheter-based technologies. On the first procedure, we repaired a valve of the heart without opening the chest, something historically the domain of the open heart surgeon we were able to do with a small catheter in the leg. The second procedure was a coronary procedure, same thing, generally the domain of the surgeon doing open heart bypass surgery. We were able to unblock or open those coronary arteries by simply passing a catheter, this time not even through the leg, through the wrist. And again, that patient went home the same day. So a lot of advancements, and we've miniaturized, if you will, our approach, our technique to repairing valves and opening blocked arteries.
Okay, the next one, what are we doing here? Because this is this one I feel is going to be more intense to do. Am I right?
I think it's going to be different, a little bit more intense maybe, but you had said to me that you'd been reading a lot about valve disease, and I think you were absolutely right. This is a growing technology, a growing space for the cardiologist, for the interventional cardiologist and the surgeon. We're working together, and what we're going to work together on is a valve replacement. We're not going to repair a valve. We're actually going to replace the valve. Now, if you look here, valves are one-way doors that allow blood to move from one chamber to the next. And there is one valve here called the aortic valve, which is the main doorway out of the heart. Now, very common, especially in the elderly, that valve can close off. With time, as patients age, the valve goes from being a very soft structure to being a very stiff, rigid structure with a lot of calcium on it. So what we're going to do live the next time is to, once again, pass a catheter up the leg and replace the valve. Now, this is fairly new technology. This was just FDA approved about 9 or 10 years ago. And if you think about it, historically, valve replacements or aortic valve replacements, like what we're going to show, took an open heart surgeon and the patient had their chest open and usually stayed in the hospital for anywhere from 5 to 10 days. What we now have is a technology whereby we can pass a catheter that has the valve on it up from the leg, and we can do that valve replacement. It's called TAVR, and TAVR simply stands for Transcatheter Aortic Valve Replacement. There's been so many giant steps forward in the last 10 years since we started doing TAVR, and I think you are going to witness that and to come back into our cath lab.
Wow, I'll tell you, I'm excited to do this one because it does mean a lot to watch you guys work at this type of level here, Doctor. I know you need to get back into, of course, the operating room. You got some other patients there. I appreciate you taking a few minutes out. Our next time we're going to sit with you here in the studio. We'll talk more about what we're going to be seeing on the third procedure that you're going to be doing with your team. And we're going to have a couple of new players here because this is a different procedure. So we'll talk about that on our next talk, of course, how this one's going to look. And again, continue talking about heart disease and preventing it and getting taken care of. So, Dr.
Brad, it's always good to see you. More importantly, it's great to have you in the operating room with us.
Thank you, Doctor. I'm looking forward to it. And of course, you can go to aztv.com/theprocedure to see the other 2 procedures that we are done and our interviews leading up to those and more about our talk that we have about heart disease. So, Doctor, I'll see you soon.
See you soon, Brad. Thanks.